Here are 5 questions that a physio or a therapist may ask you if you have sciatica, and this is why they ask it. So I can tell you this because I'm a physiotherapist and have been for the last 25 years. My name is Nigel and I specialise in treating people with sciatica. So one of the first things you might get asked is your age. And the reason why you ask the age is because it is relevant for a whole variety of things, but particularly it is relevant because it can tell us what the likely diagnosis is of your problem straight by looking at your age. Because if you are over the age of 65, then it's not very likely that you will have a disc problem, because over the course of our lives we lose the water content in our discs, and that means that the oozy bit inside our discs that tends to push out and what people refer to as a disc prolapse or a slip disc doesn't tend to happen when you are over the age of 65. In fact, it's much more likely that it is related to degenerative changes and narrowing of the spinal segments. This is what we call spinal stenosis. And the two things, a disc problem and a stenosis problem, are treated actually very, very differently, sometimes in the opposite way. And so it's relevant that how old are you can determine then what the therapist is likely to do with you. If you're over 65, it will be mobilizing the area, and if it's under 65, particularly in the ages of kind of 30 to 55, then you're going to be more likely to have a disc that's causing the pain that's radiating down your leg, and you need to do some other things like Mackenzie's extension exercises that are going to help to reduce that problem. The next thing that you might get asked is the duration of symptoms. And the reason why this is relevant is because the longer you have something, quite often the longer it takes to settle down. And this can be to do with the fact that you could be compensating. These compensations, over if you've had it for a long period of time, can really get ingrained in the way that you move and the muscles, and you can be really tight and weak in certain muscles, stiffness in joints. The longer you have something, the longer you have given it the chance to ingrain those negative changes. And so it takes a little bit of unpicking to get it better. However, if you've recently suffered a severe onset of, say, sciatic pain down a leg, and you start to do the right things from the get-go, it can actually mean that you get better quicker. So I would always recommend that if you have radiating nerve symptoms, sciatic leg pain, that you should try to get this seen to as soon as possible. Another question, a really key question that is a screening question, is whether you have any changes to your bladder and bowel function. So do you have any incontinence that has recently come on? Do you have any numbness around your bottom? Because that can be a sign of a very, very rare but serious problem called cauda equina, which is where the spinal cord is being slightly compressed. So whenever a physiotherapist gets a nervy type of problem presented to them, like from a lower back perspective or down a leg, they will always ask this question to make sure that you're not suffering from any spinal cord compression. It's incredibly rare, but it's always worth checking out. If you did have any of those symptoms, you need to go to the emergency room as quickly as possible, because if it's not dealt with quickly, then it basically could become permanent. So if in doubt, always get these things checked, and a physio will always ask that question. Do you have any previous history of sciatic problems or lower back pain? Again, this can be an indication of how long it may take to get better, because if you have had a previous history, episodes in the past, and certainly the frequency of those episodes, you're going to take a little bit longer to get better, because you might have an element of some kind of weakness there or structural issue. If you've never had any problem, then basically it means that there's good chance that you can get on top of this. And if you see a good physio, a good therapist, you do the right exercises, you adhere to rehab, there's a great chance that you'll never have problems again. We ask about aggravating and easing factors. Now, this gives us an indication of confirmation of what the problem is, because people who bend and have a lot of pain going down their leg tend to have a disky type problem, and people who lean back and find problems with standing and walking tend to have more of a stenosis problem. That's a massive generalization, but it's there's a lot of truth in that. And so we ask, what are the aggravating positions? What makes your leg symptoms worse? Is it going for a walk? Is it sitting down? Or what are the things that make it better? Is it lying down? Is it sitting? Is it walking? These can be different for everyone because sciatic symptoms can be caused by a variety of different things. And so we have to get to the bottom of what the actual cause is for your particular problem. So we ask this question, we make a list of aggravating factors and things that make your leg pain worse, and we ask what are the easing factors, things that make it better. And actually it's a really good practice for you to do yourself to try to maximize the easing factors and minimize the aggravating factors. And that in itself can help the nerve problems to settle down and for you to feel a good deal of pain relief. Perhaps you'd like to tell me your aggravating and easing factors in the comments below. If you'd like some more help from me, feel free to get my ebook. It's free and it's just giving some more information about the do's and don'ts of things to do with sciatica. So I hope that's useful to you.